This is Susan. She is a patient of Dr. Barrett. Thank you for coming again. So if you want to share a little bit about the diagnosis of your condition, what brought you here?
So I was diagnosed with osteoarthritis in my left hip, and it had been years of physical therapy, all sorts of stretching, changing up my exercise routine, just trying to figure, why is my hip bothering me so much, and finally seeing the right doctors and getting the diagnosis of osteoarthritis, and it was pretty significant. There was no going back at that point, and looked around for a number of different doctors to talk to, held off talking to surgeons because I felt like I know what surgeons do and wasn't quite prepared for that, but really in talking to other people that had had significant hip issues, very quickly the community pointed me to Dr. Barrett.
Wow.
And so I spoke with Dr. Barrett. He very quickly, reconfirmed the previous diagnosis that I had had from a different doctor of osteoarthritis, and really said, it's your choice when you're ready, and just gave me all the information I needed, answered all my questions, explained everything from the procedure to what the recovery would be like to when I would be back, 100%, and but no pressure, to have the surgery. And so I think that was one of the surprising values that he added, was just really being able to talk to an expert and not necessarily a surgeon. I didn't feel like he was pushing for the surgery, which was nice. So that's really what what kind of brought me here, was realizing that the best course of action for me was to have my hip replaced, given my age and the fact that I was very active and had gotten to a point in my life where I was starting to modify too many things. And so it was hikes were out, running was out. Where we would park the car to go to an event started becoming something I would have to think about. Anything that just really put pressure, on that joint. The pain was fairly constant. It was acute if I was walking, obviously, long distances, or jumping and running, but that was long gone years prior. But yes, and one of the things that really became significant was sleeping. And surprisingly, if you're just laying there, that it would hurt quite a bit. And I was realizing I wasn't getting good sleep, waking up a lot at night, that kind of thing, and quite achy in the morning as well.
Okay. So what was the main factor, kind of the decision point for you that went from, kind of no pressure thinking about it to actually taking that step and going in for surgery?
For a long time, I had to take running off the list and long walks off the list, but I was still able to do things that didn't have a lot of pressure, like biking or swimming, or even going to the gym and doing standing squats, or anything that would involve squatting was okay. And then that kind of became not so okay. And then I thought, oh, now what am I going to do? And felt like I was looking at being more sedentary, gaining weight. I couldn't quite figure out how is this going to work. So I think that was the point where I decided to look at hip replacement. That was an anterior approach, which I had never heard of until I was talking to people in the community, clients and friends that had had hip issues, and someone said, hey, check out the anterior approach. And so then I knew what to look for and started doing my own research, and of course then talked to Dr. Barrett about it. So it was anterior approach, which was phenomenal. I had heard that the recovery was much quicker than the posterior approach, and it was. I mean, the things that I had to, what they call the restrictions that I had, were really short-lived, for the most part, with the anterior approach. The recovery was really as expected, which was, I still thought, phenomenal. So they have you up and walking really the same day, with obviously a lot of assistance. That first day you're out of surgery, and up with a walker a couple of days in the hospital, and then very quickly I was able to put enough weight on it where I had one crutch for I think about 2 weeks, and then moved to a cane for maybe a month, and then just slowly, you don't need any assistance anymore, and there's there's no prescribed, for me there was no prescribed time that, oh, you have to have a cane for a month or 2 months or something. It's, with, I think, the anterior approach, the risk of dislocation is so low, or it's lower than the posterior approach, that it's really whatever you can handle. So if you're using one crutch and it's going well and not feeling pain, then move to the cane. And if you're on the cane and not feeling pain and very mobile, then it's time to drop the cane. So it was nice that it was sort of self-led in terms of the recovery and how quickly it could progress like that.
So you're running now, and what kind of activities are you back to?
It's funny how I had to retrain my brain to be able to think about things where I would walk again. So for example, I used to never think about walking our dog because it was off my list. I didn't walk the dog. It wasn't my chore. And it was not long ago, maybe 4 months after surgery, that the dog needed a walk, and it just dawned on me, like, oh, I can walk the dog. That's something that actually I can do. So, walking, I don't worry about where I'm parking in terms of distance to wherever I'm going. Short runs, and I'm assuming long runs if I want to. They advise you not to become a marathon runner probably after a hip replacement, but certainly as part of like a circuit workout, a run 250 yards or 250 meters and back or something like that. And so just starting slow, and it's not a heavy sprint. And I'm sure that after the months go by, if I wanted to really start to put more pressure on it, I could. But it's feeling good.
How about like your pain throughout the day and the threshold of pain, like at night, sleeping? Has that changed for you too?
Yeah, that was one of the biggest things that changed. I mean, even the day after surgery, you're noticing that the chronic ache is just gone. It's just that chronic pain is gone immediately, even right after surgery. And then the sleeping is amazing. I used to have pillows put between my knees and under my knees and different things, and I almost got used to it because it kind of feels good on your back. But now I don't need it. It's like if I don't think about it, and because I can sleep comfortably. So it's just the quality of life with my family. I have a teenage son and my husband, and we are very active, and it was hard to plan family vacations around what are the things that I could do. And they could always go off and do their own thing, and we would try and find this nice balance of, oh, I can do that, but you guys can go do these things separately, and then we can do these other things together. And so now we're just back to, hey, what do we think is fun? So that's really
That is good. So how was your experience with the staff, Dr. Barrett, and the actual experience?
Yeah, that exceeded my expectations, frankly, and I've told Dr. Barrett that and Jana that the experience with Dr. Barrett and Jana was, I thought, very efficient but not cut too short. So the meetings with them were, for someone who's busy and has a busy schedule, they were enough. I got all my questions answered. I got as much time from them as I wanted, and not a bit more, which was nice. And then the actual hospital experience, right from the get-go, one of the things that puts you at ease is just the check-in process, the pre-check-in, so you get as much of that just paperwork out of the way. I had never had surgery before of any kind, and so I'm just not knowing what to expect. And so that was very well organized in terms of getting all the paperwork, and there's a bit to just get through there with insurance and everything. And then once you start to check in, the other thing that was really reassuring was all of the precautions to prevent infection. And so they're even sending you home with different soaps and scrubs and things to scrub yourself down. So you're starting the disinfecting process at home. You get here, there's a disinfecting process right just literally the first place you visit when they're checking you in, kind of giving you your gown. And then there's obviously more things happen, in the operating room that are quite, to sterilize the whole situation. So that really exceeded my expectations, and that is one of the biggest risks of any surgery is risk of infection. And just right away you get the sense of, okay, everything is being done here that is known to man to prevent infection. So that felt very, very reassuring. And the other thing that was really great about Dr. Barrett's staff was they do joints. this is what they do. And so the care was very tailored to what they know the issues are with joint replacement and post-surgical issues with that. And so the nursing staff, all levels of the nursing staff and care staff, were quite knowledgeable, I felt, really about the procedure itself, and not just the taking the blood pressure or things like that, but they really had quite a bit of experience in obviously caring for people that had recently had hip replacements, and really partnered with me in terms of my pain level. They work with you right away and say, well, what is your pain tolerance, and it's kind of a moving target a little bit, it's hard to describe, and really work with you on what's your level of pain tolerance, and they would try and get you there as quickly as possible, and were very communicative and just delightful, really. Yeah.
How about the follow-up care afterwards? Was that still of the same caliber of?
Right, it really was. Again, there was a lot of precautions taken, which in that first week or two, there's quite a lot of follow-up care in terms of making sure your blood is thin enough so you're not having any blood clots, just a constant sort of testing, checking in, that kind of thing. So again, I felt well taken care of. And that's the time when you just kind of want it to be over, but yet they're like, oh no, you come back for these tests and let's make sure everything, all your medications are right, and your pain is well managed. So it was all obviously to my benefit.
Good.
So that was good. Yeah.
Well, would you recommend others to Proliance Orthopedic Associates, or what would you tell your friends about it if they were considering?
The biggest thing for me was not just my own experience, but this is what you do here. That you're a specialist in this, and the whole operating area, the office. Everyone has been down every road you could possibly take, probably when it comes to a hip replacement or other joint replacements. So, what I would recommend to someone is their situation, whatever it might be, and it would be potentially different than mine. This group of people have probably seen it before. They've probably seen it hundreds and thousands of times before. And so I think just that specialty, that experience, and just I think the attitude, it's really, you walk in and it feels like people want to be here. That says something, especially when you're doing something fairly significant to your body. So yeah, I would definitely recommend it to friends, family, anybody, even if they lived, far away.
Well, thank you so much. I appreciate your interview very much. It's a great story.
Oh,
Happy to hear
it.
It
Has a good ending. Absolutely.
Yes,